The transition summary document is very useful because it outlines everything we need to know, and it's just the facts but not all the story, because we can go back in time and look for the story and look for the details and so on. And it gives me a recipe to be able to figure out, okay, what do I need to do now? Who are the specialists and the subspecialists who are taking care of my new patient? Who's the previous provider that I can go to and talk to for advice or when I need some help, or to try to figure out, what were you doing with this? What was the idea here? When you did this, who were you working with, and what medicine were you choosing, and what tests were you following? And that makes a big difference for me. I'll usually set up a to-do list on that first visit and to say, okay, well, we're transitioning the gastroenterologist, but we're not transitioning the neurologist for right now, because maybe there's something going on with neurology and that problem is not yet ready to go. And then I personally like to have, and then I'll do a cursory exam, usually a relatively slight one, to make sure that I know some of the things that are going on. And then I like to have my new patient come back for a more detailed exam. And the detailed exam usually is a head to toe or a scalp to toenail exam, looking for everything to make sure that I have documented things properly in case things change. Partially that's important for me. It's easier for me to remember things like that. It's also important because as an adult provider, I may not be there when the child is admitted. I try to be there, and I try to do at least a social call, if nothing else. But that information is available to the other providers who may end up covering for me if necessary. And so we try to develop a systematic database, not in a computer format, but like a systematic list of different information that can be accessed easily. These new techniques are very useful for both providers. And then the neat thing is a lot of parents will carry their own summary, mini medical record. And then some of the patients, as they get older, they get to take that thing and, maybe they put it in a box, or maybe they bring it to their own doctor visits, and that's something that they get to have. It's really their choice, isn't it, for the future.